for him are symptomatic of the disease we failed to adequately treat for 4 centuries. Racism has never really gone away. It has only manifested itself in different ways, from incarceration rates to health outcome disparities, the wage gap to housing, in transportation, and in education inequity. It is a step in the right direction that all the officers involved in George Floyd's death have now been charged with crimes. I'm hopeful that justice will be served in the case against the men who murdered Ahmaud Arbery. These deaths are not anomalies. However, the prospect of justice for the deaths of black men and women has been all too rare. There has been no justice for Breonna Taylor, a black woman who was shot and killed by the police while sleeping in her own bed. We hear the echo of the words of Eric Gardner. We relive the pain of the death of black Wisconsinites like Dontre Hamilton, Seville Smith, Ernest Lacey, and Tony Robinson. We listen to the call and repeat, answered by a generation of black voices who've marched before in these very same streets. Millions of people around the world have gathered to memorialize George Floyd, to demand change and accountability, and to call on this country to keep its promise of justice, fairness, and equity. I've seen the hope in those who've joined this cause in peaceful protest, not only in Milwaukee and Madison, but in Wisconsin towns like Sheboygan, Toma, and Wausau. The people of our state are supporting their neighbors and showing up with brooms and dustbins in hand to help clean up our neighborhoods. We must use this dark moment to begin to be an example for the rest of the nation. We must fix what we know is broken in our society. We must intentionally address and dismantle individual and systemic racism, discrimination, and bias. Earlier this week, I called upon the legislature to immediately pass Assembly Bill 1012 that would reform our use of foreign policies by prioritizing preserving life and minimizing the use of force, and send it to my desk for signature. Accountability for unacceptable use of force by certain law enforcement officers in our country and our state, it's a good start, but there's much more work to be done. I'm also calling for local government leaders to join us in demanding change, and I am asking for partners to step up in every corner of this state and put in the work that needs to be done. This is a watershed moment for our nation, one that requires everybody willing to come together. We need systemic change to address the disease of racism in our state and our country. We have seen its effects in the disproportionate burden that people of color have borne in this COVID-19 pandemic. Black people make up only 6% of our state's population, yet our black friends, families, and neighbors represent 19% of the total cases and 25% of the state's deaths. Similarly, Hispanic people represent 7% of the state's population and represent 34% of the total cases and 10% of the deaths. These statistics represent real people whose lives have been affected by inequities that cause them to suffer disproportionately from chronic diseases like heart disease and asthma. These same inequities increase their risk for COVID-19 and put their health in greater danger. Wisconsin continuously ranks among the worst in the nation in disparate outcomes for marginalized populations. Black babies are 3 times more likely to die than white babies. In Wisconsin, the white infant mortality rate is 5.2 per 1,000 births, compared to a rate of 5.7 for black babies. Further, at 15.7 per 1,000 births, the mortality rate of black babies in Wisconsin is the worst in the nation. One of the most important ways we can help work to address these racial disparities in health outcomes is by accepting federal funds to expand Medicaid. Not only would we be able to provide health care coverage for tens of thousands of people, but we would reinvest in our healthcare systems and local public health systems. By expanding Medicaid in Wisconsin, we can improve access to quality, affordable health care for people across our state and help address disparate health outcomes for people of color. And at a time when our state and local governments are dealing with budget shortfalls, where Main Street is struggling, where more and more of our neighbors are underemployed or out of work entirely, and where all too many families are experiencing housing insecurity and food insecurity, expanding Medicaid makes good financial sense too. Analysis by the Wisconsin Department of Revenue shows that in federal fiscal year 2020, Wisconsin residents will pay an estimate $1.01 billion a year in federal income taxes to support Medicaid expansion in other states. Wisconsin residents experience no financial benefit or return for this spending, and they can expect to pay this amount regardless of whether the state chooses to expand Medicaid coverage. It is unconscionable to me that we are leaving these funds behind in Washington, D.C., instead of using our tax dollars to improve health outcomes for folks in Wisconsin. But we can't focus solely on health care and health outcomes. Racism itself is a public health crisis, one that impacts every facet of our lives. 1 in every 3 black kids in Wisconsin live in poverty, a rate that's 3.5 times higher than that of white kids. Black Wisconsinites are more than 11 times more likely to be incarcerated than their white counterparts. In Wisconsin, 85% of white adults aged 25 to 54 are employed, compared to only 61% of black adults in the same age group. This disparity in employment of prime age workers is the worst in the nation. Black Wisconsinites are nearly 3 times more likely to be unemployed than white Wisconsinites, which is the worst unemployment disparity in the nation. The median annual income for white households in Wisconsin is just over $59,500, a little more than twice as much as the median income for African American households, which is $29,000. We also see the disparity in housing, where more than 70% of white families own their home, compared to just 27% of black families in Wisconsin. To say it bluntly, these statistics are sobering and they are devastating. Just like we cannot look away from police brutality and the killing of black men and women, we cannot look away from the reality that inaction, indifference, and institutional racism has harmed generations of black and brown Wisconsinites. This cannot be who we are any longer. We must act. And now, before Secretary-designee Andrea gives her COVID-19 update, I'd like to let you hear from one of the healthcare workers on the front lines, Dr. Patricia Golden, Primary Care Medical Director at Ascension Medical Group in Milwaukee. Dr. Golden, take it away.
Thank you so much, Governor Evers, and thank you for your words. I want to thank you so much for the opportunity to discuss Ascension, Wisconsin's response to the COVID-19 pandemic. Ascension, Wisconsin's mission calls us to those who are most vulnerable. Early on, we understood that quickly identifying cases would help to immediately isolate patients and prevent the spread of the virus. Our next step was to set up testing tents throughout the state. It was critical that all communities had the opportunity to receive testing, providing us essential information to trace the spread of COVID-19 throughout our state. That led us to open 22 testing tents across Wisconsin, from Racine to Eagle River, from central city to suburbs to our most rural communities. Our teams constantly adjusted our screening and testing processes to follow the CDC and Wisconsin's DHS's guidelines. In addition to these 22 testing sites, we recognized the need to go a step farther. Keeping our patients, our associates, and our community safe was the driver behind our decision to open up respiratory clinics. We developed 15 clinics designed to provide a controlled and safe environment for our patients and our healthcare staff. Establishing these designated care sites allowed Ascension, Wisconsin to effectively isolate patients with cold and flu-like symptoms from patients without symptoms. Science tells us that one of the most effective ways to understand and contain a pandemic is to have an effective testing strategy. Looking back over the past few months of this pandemic, our testing protocol has reinforced this data-driven principle. Armed with this knowledge, we have collaborated closely with our public health colleagues to develop a better picture of the epidemiology and course of this disease. By recognizing the need and acting quickly, Ascension, Wisconsin took the lead in community-based testing. Working with our health system counterparts, community health clinics, and the National Guard to build on what we've learned, has supported further expansion of testing capabilities statewide. We are all in this together. We are stronger together, and we all benefit from sharing our collective expertise and strengths to care for the communities we are privileged to serve. Thank you so much. I'll hand it over to Andrea.
Good afternoon. Thank you, Patty, and the staff at Ascension. You all have done tremendous work, and we are really, really grateful for your efforts to expand testing. To build on what Patty just said, I want to reiterate the importance of testing. Testing gives us vital information to guide our recommendations and plans as this pandemic progresses, and testing also gives you vital information about your own health and safety. Please, if you need a test, get a test. If you're experiencing any symptoms of COVID-19, or if you have been exposed, call your healthcare provider to get a test. We also continue to update our DHS website with locations of community testing around the state. I want to acknowledge that the challenges we face today go beyond COVID-19. We cannot ignore the tragedy of George Floyd's death and the outpouring of grief and understandable anger that have followed. Racism has no place in our society, and it impedes our mission at DHS of health equity and optimal health for the residents of Wisconsin. Please, if you plan to protest, do it as safely as you can. Wear a mask, stand 6 feet apart, and wash your hands whenever you can. At DHS, our mission is to protect and promote the health and well-being of Wisconsinites, and that means we must speak out against racism and work to change the systems that have led to the health inequities we see in Wisconsin, including the disparities we see in our COVID-19 numbers. In terms of our numbers, here is where we stand today. We have 61 active labs running COVID-19 tests in Wisconsin with a daily lab capacity of 15,418 tests. We have 291,367 negative tests, which is an increase of 11,656 over yesterday. There are now 19,892 confirmed cases of COVID-19 in Wisconsin, which is an increase of 492. Our total deaths have now reached 626. COVID-19 is still prevalent, and it is still spreading in our state, and I know this situation wears on people. We talk a lot about being partners, about working together to stay safe during this pandemic. And it's true that we are all in this together, but that does not make it any easier. What we need to do to stay safe is difficult, but it is incredibly important that we stay the course and continue to follow the best public health guidelines. We talk at these briefings about staying home, about limiting your essential trips, and practicing physical distancing. These are important general guidelines. Another helpful guideline is to wear a mask or a cloth face covering if you can. We do recommend wearing a mask when you're out in public, especially when physical distancing is difficult. And we also recognize that some people do not feel safe wearing a mask covering because of fear of discrimination, or they are not able to because of a medical concern. It is important not to judge each other for not wearing or for wearing a mask. It is also important to keep in mind that a mask does not replace physical distancing. We still need to practice physical distancing whenever we can. This weekend looks like it will be a good one to get outside for some fresh air. The safest way to enjoy time outside is to do it with the people you live with. If you're meeting up with other folks, limit the number as much as possible and practice physical distancing. Wash your hands frequently, especially if you are touching shared surfaces. Also, now's a great time to explore your local community. There are likely some great hiking trails near you, and taking a walk or a hike nearby is a good way to get outside and avoid traveling very far. Our DHS website has more ideas and information on safely spending time outside. The general theme here is that the safest idea is to limit your interactions to the people you live with and to practice physical distancing and wear a face covering when you are out in public. We know this isn't easy. In fact, we know it can be overwhelming. So please remember, it is also okay to ask for help. We thank you for doing your part to protect your health and the health of your fellow Wisconsinites.
Thank you. We will now take your questions. A reminder to maintain audio quality. Please keep your phones on mute until it's time to ask your question. Also, in the interest of time, only one question per reporter per media outlet. We will begin with John Doran from WLUK-TV in Green Bay.
Hi, my question's for the governor. We've seen the National Guard deployed around the state, curfews put in place, including up here in northeast Wisconsin, in response to the protests. But assuming the protests are something we're going to see for maybe weeks or months ahead, have you talked to any local governments or local law enforcement on coming up with a plan if that is the case?
Thank you for the question. Clearly, the people of Wisconsin are interested in expressing the First Amendment rights, especially about something as important as racism. And so I, frankly, as governor, I've been pleased with the outpouring of interest in doing that. And I am on the phone regularly, not only with local officials, but also those on the ground, people that are expressing their First Amendment rights, just to keep an idea of how things are going, making sure that people are safe, making sure people have that opportunity to protest and express their concerns. So we will continue to do that. It's I think too early to make a guesstimate of the prolonging of these happenings, but I also believe that our ability as local and state and national leaders to respond quickly and forcefully, not against protesters, but actually accomplishing some things to alleviate the systemic nature of this curse on our nation and our state, the sooner that people will stop protesting and join us in correcting the system.
Thank you. We'll go next to Danny Maxwell with WKOW-TV in Madison.
Hi, this is JT filling in for Danny. My question is, how do the ongoing protests affect public health planning, given that there are all of these large gatherings going on in the midst of a global pandemic?
Yeah, so I think we continue to be in close touch with all of our local public health colleagues, particularly in areas where we're seeing mass gatherings such as protests. And you know, the work that we do is fundamentally the same, right? It is once you have a positive test, it is isolation, safe isolation and quarantine, and the contact tracing that is necessary to make sure you are wrapping around that positive case to keep its spread as small as possible, and do the necessary public things to reduce spread and protect that community more broadly. We certainly are prepared as communities need additional assistance from us, whether that is contact tracing assets or resources to surge those for local communities, but we continue to stay in close touch so we understand what's going on the ground as it relates to COVID-19.
Thank you. We'll go next to Jason Calvi with Fox 6 Milwaukee.
Good afternoon. Thank you for taking my call. This question is for the governor. I appreciate your time here. On the bill you proposed, the legislature is out until January, so how will that bill actually help?
Well, that would help if we're trying to arrange a conversation with the legislative leaders to see if it's possible to act on it before then. But right, it isn't going to help if we wait until January. So I think there's some opportunities. Hopefully we can make that happen. But we're trying to set up an appointment as we speak.
Thank you. We'll go next to Bill Leaders with the Progressive.
Hello.
We hear you, Bill.
Hi. There is concern that the abandonment of social distancing guidelines in some corridors, as well as the large gatherings of protests, either already have or will facilitate the spread of COVID-19. What steps are being taken to trace confirmed cases back to, say, people who flock to crowded bars after the Supreme Court struck down safe or at home, or those who are taking part in protest, when we know statistically if these have an increasing rate of transmission?
I'll let Dr. Westergaard speak to the statistical piece of that. I think, fundamentally, contact tracing is about understanding who you've been in contact with. And so that interview naturally surfaces places you have been, people you have been in contact with, locations, the context. Was it a large gathering? Was it a few people? And so our contact tracers are trained to do that kind of work and ascertain contacts. And we will continue to do that. You're right that certainly lack of social distancing and large gatherings facilitate the spread of COVID-19. And we are doing everything we can to support our local public health in doing the work that is necessary to stop the spread and minimize the number of folks that a positive case infects moving forward. I don't know, Ryan, if you want to say any more about the statistically significant piece of this.
This is Ryan Westergaard with the Division of Public Health. I'd say that the data that we collect to inform that come through, as the Secretary said, the contact tracing process, where we systematically ask people, both individuals they've been in contact with and events, public spaces and activities, which would include the protests. So whether we determine that the participating in protest was as a strong signal for increasing the risk of contracting COVID-19 is going to emerge in the weeks ahead. Whether there's a strong signal there doesn't really matter with our response. Our response right now needs to try to keep everybody safe proactively, which is to understand that when people are out, they need good information about how to keep themselves safe, which are the things that we've said during this briefing and all along, which is wearing masks in public and keeping physical distance. So the data will be able to tell that story, but we're not going to wait for the data to analyze the data before trying to get it undo our prevention messages that we do.
Thank you. We'll go next to Casey Nelson with WTAQ Radio in Green Bay.
Hi, thanks again for taking the call. Just looking statewide at the numbers, the last few days they've been pretty even, pretty steady. Is there any perception or any idea that we might be kind of working our way out of the woods here, maybe heading down towards a bottom with the numbers of COVID cases across the state? Thanks.
So I think one thing we certainly know, Casey, is that this disease is still prevalent in communities, that it is still spreading. You can see that in the hundreds of positive cases we are getting on a daily basis. And while, to your point, we have certainly together as a state done a really important and good job of flattening the curve, we certainly want to see it going in the right direction, which is decreasing numbers of cases. We have, as you suggest, seen good positivity rates, percent positive over the last week or so, and that is certainly encouraging. But I also would invite Dr. Westergaard, if you want to say anything about this concept of whether we've bottomed out.
Yeah, it's a good question, and unfortunately, I think the answer is no. We don't have any reason to think that we've reached the bottom, or that things can't get better or worse here. This is still a really dynamic situation, and there's a lot of positive things. I think there's a lot of evidence that we've made the epidemic curve look much better than it could be. But lost in some of our numbers is the heterogeneity, by which I mean if we have a percent positive rate statewide of between 3 and 5%, that's overall it is good. And when there's certain communities that have a percent positive rate of 20 to 30%, that's a big problem, because we know how quickly a community area, a hotspot, if not contained, can spread into a larger community or a regional hotspot. So we are by no means out of the woods. We're pleased that the numbers are not higher than they are, but they're at a level where we need to be really vigilant and really aggressive in trying to understand where these hot spots are, particularly heavy hit communities and particularly congregate living situations, jails and nursing homes. So I don't think until we really have a very low level where infections in those settings are rare, I don't feel like we're going to feel like we're anywhere close to being out of the woods. In fact, we need to really double down now to make sure that the number of facility investigations have all the resources they need to prevent them from spilling out to a wider community or regional epidemic.
We'll go next to Scott Bauer with the Associated Press.
Hi, this is Todd Richmond standing in for Scott. Can you hear me?
Yes.
Before the call began, your mic was hot, Governor, and you could be heard asking, I believe, the Secretary Paul, when you could declare victory on this virus. Did I hear that correctly? And what is the decision on when you will declare victory on this virus? It seems to suggest you are thinking along those lines, that we are approaching the end of the tunnel here.
Well, the real answer was just given by Dr. Westergaard. The question I had was, and this was from someone who is not a statistician, is that seemingly the percentage of positive cases per total number of tests every day seems to be plateauing. And if we are going to make a judgment, that being a green dot, then that would mean that there has to be a downward trend. Well, if it's alternating between 2 and 3, 3 or 4, 4 and 5, whatever, that's going to be difficult to find a downward trend in that case. And so my question to her was, so what do we do? Do we assume at some point in time that if it's a flat line that's a downward trend or not? And she suggested that we wait to hear from Dr. Westergaard, which we just did.
We'll go next to Mark Stevens with CBS 58 in Milwaukee.
Andrea, I understand what you're saying about there is contact tracing in place, but how concerned is the state that these mass gatherings, specifically the protests, could really act as new infection seeds and continue to spread the virus?
Yeah, I think as we have said throughout this, right, it was the rationale for limiting our contact with other people, right? That is how this virus spreads until there is a vaccine to prevent the virus. And so any type of large gathering, particularly ones indoors, are a significant risk for the spread of the virus. And it's why we are encouraging folks, and why my opening remarks encouraged folks who are going to protest to do it as safely as possible, to wear a mask, to throw your hand sanitizer in your backpack when you go, to make sure that you are practicing physical distancing as much as you can in these settings. But I think that it certainly is a risk, and as Dr. Westergaard just talked about a minute ago, the data will tell us how much spread we have seen or will see in the coming weeks as we start to do that contact tracing and start to ascertain from the interviews that we do what kind of contact people have had and what are the kinds of things that are spreading this infection.
We'll go next to Sari Lesk with the Milwaukee Business Journal.
Yes, hi, thanks for taking the question. With people returning back to work and other activities such as the protests that have gone on in the last few days involving more interaction, I was wondering if you could give us a sense of how often you recommend people get tested. And I'm also wondering, in that, what are the numbers showing us on testing? Do they at all reflect the same person being tested, or are these numbers for one test per individual?
The test results we do report are people. Whether there are folks who have received multiple tests is certainly a possibility, and I will tell you, when related to some of our outbreak testing work that we have done, we have tested people multiple times, either to make sure that the spread has stopped or to ascertain additional positives to take necessary actions to stop the spread. So there certainly could be people reflected in our totals who have had multiple tests. Dr. Westergaard, do you want to add anything here?
Yeah, I'd be happy to. About the piece of the question about how often should individuals get tested, I think that the best answer to that is more when should people get tested, which we want people to think of it going forward. Any symptoms that could be a respiratory infection, a cold or a flu, or the typical symptoms that people get with respiratory infections should prompt people to get a test and to talk with their healthcare providers to think about how do I get a test, or to use a community testing site. Now, if someone doesn't have symptoms, there are some situations where getting a test makes sense, but those are generally rare. It's generally those situations where someone who feels totally well getting a test is when it's recommended by someone in public health or in medicine as part of an investigation or as part of a concerted effort to find cases linked to an area where there's community spread. And a good example of that is our strategy for testing people in living situations like nursing homes, assisted livings, and jails. So low threshold for getting a test anytime someone has symptoms. If negative, it means those symptoms are likely not related to COVID-19, and it doesn't necessarily require a follow-up test. There are some situations where someone who tests positive might get a follow-up test to indicate that they have cleared the virus, but those settings are more unusual and more related to healthcare settings. Usually the most important thing when someone gets a positive test is that they're in isolation, and we take care of them, we monitor their symptoms until they're recovered and feeling better. So there's not a general recommendation for people to get tested periodically if they feel well, but for people to immediately think about getting a test anytime they start getting symptoms.
We'll go next to Katie Anderson with WBAY-TV in Green Bay.
Hello, this question is for the governor. You mentioned reaching out to other governors and other local government leaders about a lot of the protests that we're seeing and about racial injustice issues. Have you actively reached out to any minority community leaders on how to work together on social justice issues?
In fact, most of the people I've reached out to are minority leaders and those that are working on the ground, making sure that people's First Amendment rights are kept and channeling things, helping to channel things in a positive way. So absolutely, in fact, I'd say that my time is less than I want to say 10% spending time talking to local and state and national elected officials. It is with people on the ground.
We'll go next to Sean Kirkby with Wisconsin Health News.
Hi, thanks for doing this. I was just wondering, could you provide an update on contact tracing efforts? How close is the state to meeting that goal of 1,000 new contact tracers and implementing new technology to help them? Thank you.
So, Sean, I think you asked about the numbers of hires and our technology platform. So we have about 400 state employees who have been redeployed and continue to do work to support local public health in needed contact tracing efforts. We have brought on board 100 LTEs, 30 of which are bilingual in the first tranche of our effort to scale up contact tracing, and we have made offers to an additional just over 100, I think 106 people, and those offers are in process of being accepted, and we anticipate onboarding those people in the next week or so, again, to go through training and be ready to push out into the field and support our local public health folks when they need assistance from us as it relates to contact tracing. The numbers in the second round of those who are bilingual was much higher than the 30 in the first round. And if you want that number, Sean, we can get it to you, but I can't remember it right off the top of my head, but it certainly was a significant number of that second group of hires that we just made. As it relates to the technology, we are doing some configuration and integration. We are doing some pilot testing to make sure that we see and identify any issues or glitches or things that need to be ironed out before we take it to scale and move it out into use more broadly in a community testing site, for example, or in other places. And so we continue to make progress and work our way through a system that will pair with our existing infrastructure to be able to handle the kind of volume that we are seeing and that we anticipate seeing moving forward.
We'll go next to Steve Westergaard with the Platteville Journal.
Thanks for taking my question. The Madison Catholic Diocese has announced that it is either going to, or at least has threatened to sue the city, Madison and Dane County about their bans on gatherings of more than 50 people, which are patterned on the state's guidelines. And I'm wondering, because of that and because of what's happened with the protests that have been very large in some places, if the state is changing its mind at all about basically saying that churches really shouldn't have that many people together because of the possibility of spreading the virus. Thanks.
Well, first of all, it's not a state call. The Supreme Court decided that a few weeks ago. So the possible lawsuit is actually other litigant is Dane County, who has decided to set a limit themselves with the people that are for the people and institutions that are within Dane County. So unfortunately, I can't answer that question, but certainly, do we think that it's still true that if you get a whole bunch of people in a pretty enclosed place, that the chances are for spreading the virus is higher? Absolutely. I mean, that's common sense, and we're not going to walk away from common sense.
We'll go next to WISN TV in Milwaukee. As a reminder, *6 to unmute your line. We'll move on to Riley Vetterkind with the Wisconsin State Journal.
Hi, thank you for taking my call. This is for Governor Evers. This past week, we've seen obviously quite a bit of unrest in Madison and other parts of the state, especially during nights when there was a heavy law enforcement presence at these protests with plenty of tear gas and pepper spray. Do you think it was helpful to deploy the National Guard to assist with the protests, or do you think it was a step that may have led to further escalation between protesters and law enforcement?
We are very clear when asked to provide support by the National Guard that they would be used to primarily be stationed to protect property, such as the Capitol in Madison and other state office buildings. They weren't, and also in Milwaukee to protect utilities, water utilities, as well as other cultural places. So, and they did that well, and so the Guard, I think, has done exactly what we asked them to do, and the issue of there being at times some nature for law enforcement to intercede they do that with the guidance of the leadership from the local municipalities. I have to say, and I know it's important to understand how there are people that act in unlawful ways, but there are vast number of people who are protesting peacefully. It's their First Amendment right, and we can't take that away from them. In fact, we encourage them to get out and let people know how they think about this issue.
We'll go next to Jessica Van Egren with Up North News.
Yes, my question's already been answered, so thank you for today.
We'll move on to Abigail Handke with NBC 26 in Green Bay.
Hi, thanks for taking my question. Just kind of branching off others' questions. With everything going on and the virus and knowing it's not going away, is it now not a question of if someone will get the virus, but when?
So this is Ryan Westergaard. I can take that. I'd say no. I think our goal is still to minimize the spread of the virus to the greatest degree possible, and what that would look like if we're successful, even incompletely successful, is that a very small proportion of people will become infected. So far, the numbers as a percentage of the population has been very low, and it's circulating at a level where it's certainly not at all a foregone conclusion that a majority of people will even be exposed. So everything that we're doing at the state and local level and federal level is still around the idea that we can contain epidemics to keep them from spreading as much as we can. And I think the result of that would be that the very large majority of people are not exposed to the virus even in the next year. One of the things that's, I think, a big focus, and it relates to the previous question about when and if we declare victory. This is a long contest between public health and the virus, and I think we need to be focusing on what the next respiratory virus, meaning flu and cold season, looks like. And if we're going to score points against the virus now, if we're going to make progress, we need to be shrinking the epidemic to as small and as manageable level that we can, because in a few months, the people who have symptoms that could be coronavirus, could be influenza, could be any of the other viruses that cause colds and flu, is going to start going up. And we're going to feel like we're in a much better position to contain the virus and know where it is to stop local outbreaks if we do the work this summer to keep the spread of the virus as small as we possibly can. So that's really something I think we all need to have as a shared goal, is right now we're not in flu season. The total number of people with symptoms is small compared to what we usually expect it to be in the fall, winter, and early spring. So now is the time we really need our containment strategies. And it's a realistic goal that we're going to keep it small and keep it containable into the fall, but only if we work really hard.
We'll go next to Chuck Kornbach with Milwaukee Public Radio.
Hi, a question for Governor Evers. Could you please sum up your appeal at this point to Speaker Voss and Senator Fitzgerald or other Republican legislative leaders on the force bill or any other efforts to address this watershed moment you talked about?
Yeah, well, and they won't be surprised by the pitch. It's this. We have an opportunity now to fix some wrongs that have been long-standing for decades, and people of Wisconsin have a great interest in having us do that. And we have a bill out there right now that will deal with one small issue, but an important issue about use of force. And let's get together and see if we can accomplish something. I know the election is coming up. I know that's very important to all of us as a state and to individual members of the legislature. But this is a watershed moment. There are probably many things we can accomplish on behalf of the people of Wisconsin that will make lives better for folks that struggle due to systemic racism.
We go next to Stephanie Hoff with WisPolitics.
Good afternoon, and thank you for taking my question, which is for Governor Evers. Obviously, you've been in support of peaceful protests and the First Amendment, but what's your message to those who have engaged in looting or violence and businesses that have sustained damage?
Well, certainly, I've never supported law breaking, and I never will. That's part of my job to make sure that laws are followed. But yes, it is important to make sure that things are done lawfully. First Amendment rights are not to be trampled in this state or any other state. And for those who decide to do damage, they're damaging the First Amendment, and they're damaging the opportunity for thousands of people across Wisconsin to exercise that First Amendment right.
We'll go next to Zach Schultz with PBS Wisconsin.
Governor Zach Schultz of PBS Wisconsin. Given these issues are not likely to be resolved in the next couple of months, have you talked about the possibilities of large-scale protests at the Democratic National Convention, and would you be willing to have the National Guard involved in security?
Well, I can always speak for the Democratic National Convention in Milwaukee, and that it's uncertain whether that is actually going to occur in place. So I think that's too early to discuss whether we need the National Guard there or not. Again, the National Guard is not leading this effort to make sure that people's rights are taken care of and people are safe. They go places where they're asked to go by local leaders, and with our insistence that they be put in a position of not accelerating people's activities, and making sure that they're doing the job they need to do to protect First Amendment rights, and that is to guard installations and public utilities and so on. So if there was a convention if for some unbelievable reason there is a in-person convention in Milwaukee, I'm sure we'll have conversations about how that'll play out. But frankly, it's premature. The National Party is still debating whether to have an in-person convention.
We'll go next to Eric Gunn with Wisconsin Examiner.
Hi, thank you for taking my question. It's kind of a complicated one. Probably most suitable for Dr. Westergaard, but whoever else is appropriate. We've already heard discussions about possible spike of infection traceable not just to the protests of the last few days, but to the last couple of weekends in May, when a lot of people flooded parts of the state that are very popular for vacationing and tourism, resorts, and so on. How soon, number one, how soon might we see shifts in infection rates that might be attributed to those kinds of gatherings? And secondly, if you get people traveling from one part of the state to another part like that, and then going back home, and they don't get sick until after they've been in a crowd somewhere up north where they've been exposed, does that infection end up getting imputed to their home county rather than technically the county where they first may have contracted the virus?
Sure, I can take several questions there. The first one about the timing. When would you see a reflection in the epidemic curve? So what we know about the virus in terms of its incubation period, meaning the time between getting exposed to the virus and showing symptoms, is about on average 5 days and as short as 2 days. If someone gets tested the moment they start getting symptoms and the laboratory has a turnaround time of 2 to 3 days, that would be another day. So we're thinking about a week probably would be the average time. The outer bound of the incubation period can be about 2 weeks. So that's generally what we've said. We measure the data that we're seeing today in our new cases could have been the last 1 to 2 weeks of transmission activity in the community. So there is a bit of a lag. The second question was about, I don't recall. Can you say that part again?
Where are this is Governor Evers. The question was where, if someone is someplace else and they're infected someplace else and then they come home and then they're determined to be COVID-19 positive, which county gets the blame?
That's right. Thank you, Governor. Sorry.
That's right.
The way that we collect and report data is by county of residence. So the data get reported. The person who has the positive test, it goes to the local health department where their main residence is. The contact investigation or the case investigation then would explore where they have been, what other parts of the state or what other parts of the country, including their travel history. But in terms of the way that we report the data, it's by county of residence.
We'll go next to Nate Phelps with Spectrum News 1. As a reminder, *6 to unmute your line. We'll move on to Bob Haig with Wisconsin Radio Network.
Hi, question for the governor related to the legislation on policing you requested this week. Municipalities are currently prohibited from requiring police officers to live in the communities they serve. That was passed by the legislature in 2016, upheld by the state Supreme Court. Do you have an opinion on whether or not that's a problem for police-community relations, and is that something you'd like to see changed by the legislature at some point?
Yeah, I don't necessarily think, I think the more we can have any municipal employees interacting with the folks they serve on a regular basis makes us all stronger employees. That said, I also understand that where a person lives has some legal and moral right to it, and that people should be able to live where they want to live. So it's a balancing act, Bob. In the perfect world, I would hope that municipal employees would be living in the municipality that they serve.
We'll go next to Mason Dowling with WAOW-TV in Wausau. As a reminder, *6 to unmute your line. We'll move on to WSAW-TV in Wausau.
Hello, this is Emily Davies. I wanted to see if I could get an update on the situation with the CDC coming in and bringing investigators for new cases of COVID-19 and people who have already contracted it, and where that stands at this point.
So there have been a few CDC field teams who have come to assist with local investigations in the Milwaukee area and in the Green Bay area. They've had various levels of various areas of specialization. Some were in occupational health. Some they conducted a household transmission study. The specific question about reinfection that you might be referring to is a investigation that's run by CDC nationally. There aren't investigators in Wisconsin working on that. But we did, at the State Health Department, communicate the desire of CDC investigators to collect possible instances of reinfection. And that's something that's really unknown is the degree of someone who becomes infected and then recovers, how long are they protected, if at all, from reinfection? So they're very curious to understand the biology, the virology about that process. So it's an early investigation. They're collecting cases. To my knowledge, we haven't had Wisconsin cases that have been connected with them, but it might have happened. So we're really facilitating that research on a broad level, but it wasn't a specific team that was visiting Wisconsin to study that.
Our last question today will come from WISC TV in Madison. As a reminder, *6 to unmute. With that will conclude today's briefing. You can find more information on the COVID-19 and outbreaks and investigations pages on the DHS website. For more information can be found on the websites of the Governor's Office, Wisconsin Emergency Management, Wisconsin Department of Workforce Development, the Wisconsin Economic Development Corporation, and the Department of Children and Families. Thank you, and have a good afternoon.
This program is a production of WisconsinEye, an independent, nonpartisan, nonprofit media network with a mission to inform, educate, and engage the citizens of Wisconsin. WisconsinEye is the nation's first and only independently funded state civic broadcast network, providing gavel-to-gavel access to government proceedings and events at the state capitol.
Hi, I'm John Henkes, President of WisconsinEye Public Affairs Network, and I'm speaking to you today to ask for your financial support. For 14 years, WisconsinEye has provided uninterrupted, gavel-to-gavel live coverage from our state capitol, the legislature, the Supreme Court, the governor's office. We're proud to continue to do that and continue through this time of crisis with important coverage. We are 100% committed to bringing these important meetings into your home or place of work. We've created online pathways that allow us to connect you live with these important events. But WisconsinEye needs your help to do so. At this time, we are facing unprecedented staffing, technical, and financial challenge. So if you rely on our coverage to stay informed on issues you care and need to know about, I ask that you consider a one-time charitable gift today to help us through this challenge. Whether you're following the DHS briefings, the Wisconsin Elections Commission, or leadership briefings from the state capitol, or any of the timely interviews conducted by our senior producer, Steve Walters, we could use your support today. If just a fraction of the thousands who value WisconsinEye coverage say yes with a gift of any size, it will provide a huge boost. So thank you. To donate, please text WisEye to 44321. That's WISEYE to 44321, or visit wiseye.org/donate. WISEYE.org/donate. Or you could send a check to 122 West Washington Avenue, Suite 200, Madison, Wisconsin, 53703. Again, thank you so much. Please be safe. Stay optimistic. We are Wisconsin.